what are complications of an ostomy? Because this is what I do. I've been at this for 28 years, and so a straightforward ostomy patient, that's fairly routine in teaching the principles. But what do you do when you have problems and you have complication? And that's really where my specialty falls. So I just have a few examples for you. Some of the most common things that we see is one, a hernia behind an ostomy, and here's a picture of one, and you can see this big bulge behind the ostomy. Some problems that come up is it makes the ostomy change sizes from when they're laying down to when they're getting up. Also, it puts pressure on the abdomen, and it hurts. Sometimes these can get big enough too where they'll actually shut the bowel down, and so then they'll have to go to the hospital to correct that problem, and the hernia will be worked on. But most of the time when you have a hernia behind a stoma, it is very benign. It's a nuisance, but it's not anything that's an emergency. If it's not causing problems, surgeons, myself, we generally will just monitor that and try to slow that process down. Well, how do we do that? Well, we can fit patients in special therapeutic hernia belts where we measure them. It's individualized to them, and we use these hernia belts, and we actually pull their appliance through here, and we get these openings. We have all kinds of special sizing that we do, and get it individualized to them so it's comfortable for them, and this helps really support them and decrease their pain. Another problem that can happen with the ostomy is a prolapse. So these are generally, a prolapse happens over a longer period of time where the stoma actually comes out. The neat thing about it, it is not an emergency if it's a nice, good pink, moist and red, but it can be pushed back in, okay, when the patient's in a lying position or they're not putting like increased pressure on their belly, like from when you cough, you laugh, you strain. Sometimes it's a little bit, but sometimes these become so long that they do have to go to a surgeon at that point, and then he will generally trim some of that off, and sometimes they may have to do some other things, but that's when we get a surgeon involved, and we work together on that case to see what needs to be done. Again, this is not usually an emergency if the stoma is still working, it's a nice good color, it's a nuisance. We generally work with you, and we find appliances to fit these kind of problems, but if it does become symptomatic and hurting and things like that, that's usually when we take an intervention. The other thing is when a stoma will retract and it will just pull back into the belly, and it's either flush with the belly or it's sunk in. So we have all kinds of special appliances, and we have tools or accessories. We have barrier rings. We have all kinds of things that we use to build up the surface to get that to set flat on the belly and to make the stool or the urine go into the pouch instead of leaking out the edge. So if you know anyone that's having problems with these kind of complications, let them know about us, and we would love to help them or help you if you're having these kind of problems.